644-9840. Next segment, we'll be adding in Dustin Yerman and our most adoptable pet of the week. Before we even get to Pet Talk Tuesday about pets, though, because we are willing to take your calls, I'm telling Dr. Kandefer that we've added a puppy to my house, and that's been great, but I also have a 12-year-old Cocker Spaniel who rules the roost. And I'm telling Dr. Kandefer that so far, Bernie, the Cocker Spaniel, doesn't want anything to do with this puppy. He is not making friends at all, and just thinks this thing is like the biggest pain to come into his world.
And that safety safety's first. You want to make sure that that you keep an eye on them and that they have good interactions. And Bernie, being 12 years old, needs some time alone.
Yes.
He can't be constantly pestered, and that's what's going on. Is usually the puppies are so high energy that an older dog just takes a little bit of time to say, this is what I'm going to accept, and now it's time for you to leave me alone. And eventually the puppy figures out, just like your puppies are learning how to sit and stay and getting those commands down. Bernie's teaching him, I needed some time alone.
But I'm expecting Bernie to act more like the alpha male. This puppy will chase Bernie right out of the room. Bernie will just go look for a place where he can go and jump up on the furniture because he knows the puppy can't jump up yet. So here's my haven. But it's amazing how, unless he's cornered, Bernie will really growl at this dog. I'm so afraid the little puppy's going to get bit.
Yeah, and I mean, that's the one thing that it can happen, making sure that, when we're going to be interacting, we're supervised. But they do, even you could put 4 dogs together and eventually they learn where that level is and how to interact with each other, and most of the time they do pretty well. I mean, we do see behavioral issues where just some dogs don't get along with other dogs, but usually puppies, they find their level with the dogs that have been there for a long time.
Because I'm only giving Charlie like another month, and he's going to be bigger than Bernie. So it's like, go ahead, have fun now because you're still big enough. But but it's really cool having a puppy back in the house with an older dog because they just act. It's like two different species. It's amazing how different they are.
And Charlie needs to make sure he gets some time interacting with other dogs outside of Bernie, just because he's got one level of maybe this dog doesn't like me so much. He needs to figure out how to interact with a lot of different dogs.
You're right. We got to get him over to puppy play time. Okay. All right. And again, February is Dental Health Month. How's your dog's breath? If it's not so good, maybe a toothbrushing, a professional brushing is in order, and we're going to be talking about that too because for some dogs, that's almost routine maintenance.
Well, and that's, I see some dogs that are at 2 years old, and they've actually found studies that show that over half of our dogs by 2 years old have significant periodontal disease. And the problem is, the general idea I tell people is that if you went to the dentist, every 6 months and they said, let's go ahead and clean you up, and then you did nothing in between that and your next visit, the dentist is going to have a lot of bad things to say when we're talking about our pets, trying to work on that routine cleaning at home, brushing, and there are dental treats and dental diets. And there's a lot of places you can go, that do, there's a lot of things out there that you don't know if they're going to work or they don't. So what I always recommend is if you look for a VOHC stamp on anything, it's the Veterinary Oral Health Council. And they go through and they certify that they're safe and that they're effective against plaque or tartar or both. Yeah,
because you hear a lot of commercials will say, oh, this is great for your dog's teeth, but you don't really know.
Yeah, and that's the problem. I mean, some things are no better than snake oil when it comes down to it. So we're looking to make sure they're safe, and there's plenty of people that bring things in, and I can't look at everything. I mean, there's 500 different dog food brands out there. When we talk about treats and things, there's so many that it's impossible to stay up on all of them. But they do the work for us on that and say this is safe and effective. And when it comes down to trying to manage those, our pets' teeth, bad teeth are becoming more and more of an issue because our dogs and cats are living so much longer. By 20-year-old cats we have coming in, 16-year-old dogs, when they only made it to 7 and 8, we didn't have a real big problem. They didn't have time for really significant dental disease to develop. Now we're seeing it affects their kidneys, it affects their heart. It does affect things long term, and longevity is really a factor when you're constantly being inundated with the bacteria that lives in these infected teeth, and that's something we need to manage.
It's funny because I know with people, if you have periodontal disease and you tend to get plaque, that can be mirrored in your arteries. Is that the same for dogs?
They don't live nearly as long to where we see hardening of the arteries or issues like that, but it is something that if your body is constantly being exposed to this bacterial soup that we have in our mouth, that's going to be something that we're going to see progress more and more. And it's something, most people have their dogs sleeping in the bed nowadays, and it can be tough to actually have them in there with you because that smell gets so bad. That's one part of it, but the other part is that our dogs and cats, and this is something people don't always realize, is Pets don't show pain the way that people do.
That's right.
But you
It's
know, if you
important
have
to know.
one sensitive tooth, how bad that can feel.
Yes.
Let alone, you know, we have some dogs and cats come in that have, 5, 10 teeth that are just rotting in their heads, and they're still going to eat. You know, they just may not be as active. You know, people say my dog, or cat hasn't been as interactive as they used to be. When we get those teeth taken care of, we go in, we're doing x-rays, we're making sure if you've got rotten roots, most of the time by that point the teeth need to come out. You see your dog or your cat turn back into that puppy again.
And understand too, when you're taking your animal in to have their teeth cleaned by the vet, you will anesthetize them so you can get in there and really take a good look and remove any teeth that need to come out.
There's no self-respecting dog or cat that's going to sit there and do a proper dental cleaning, and that's something that's really important. When we're talking about the plaque that you see on the outside of the dog or cat's teeth, that's just surface tartar that doesn't actually cause any pathogenic problems. It doesn't cause disease. Everything's happening underneath the gum line, so just scraping off that tartar on the top is not fixing the issue. When you look at those pets' teeth and you see that red, irritated gum line, that's infected gums. And that's what we're trying to do, is get underneath that gum line, clean that all out. If we do have a significant periodontal problem, that we can manage it and keep that pet's life healthier and happier long term.
We have a phone call for you. Yes, hello, you're on with Dr. Kandefer. Good morning. Hi, caller, you there?
Yes.
Yes, go ahead, please.
My 9-year-old Peak has gallbladder stones and bladder stones. What causes that?
Oh, you know what? Before you're going to answer that, we're going to take a quick break. So you're going to think about that answer. Don't go away, caller. We'll take a quick break, and we'll be right back, and we'll answer your question and any others that you might have.